Thanks for coming, everyone. I wanted to start with a land acknowledgement, and then I'll introduce Kath to everyone, both in room and on Zoom. Thanks, everyone, for coming. Start my video. Oh, yeah, I don't have my video. Now you see me. There we go. Okay, thank you. Sorry about that. No longer the disembodied voice, everyone. We're meeting this afternoon in Montreal, also known as Chochage. McGill University, its campuses and research stations are located on lands which have long served as sites of meeting and exchange amongst Indigenous people, including the Haudenosaunee and Anishinaabe nations, the Abenaki, Naskapi, Innu and Inuit peoples, and Tainau and Kalinago peoples. Recognizing and respecting the presence of these historical and contemporary communities and their unending connections to the care of these lands and other lands on which McGill is located is a really important step towards addressing the ongoing violence and harms of colonization that have happened, and building trust and creating and renewing relationships with those traditional stewards of the lands and waters on which we're meeting. Our land acknowledgements are meant to foster a necessary process of reflection and relationship building for us as individuals, colleagues, visitors, and community members. And I always encourage people to think about your particular position in relationship to those. So hello, everyone, and welcome to today's talk by Kath Albury from Swinburne University of Technology in Melbourne. My name is Carrie Rentschler. I'm a professor of art history and communication studies here at McGill. And I'm super happy to be introducing Kath to you today. Before I do so, I also want to thank some folks as well. Firstly, the Department of Art History and Communication Studies and our speaker series, and Professor Alex Blue, who is our coordinator for a part of our coordination team that sets that up. Professor Alex Ketchum of the Institute for Gender, Sexuality, and Feminist Studies, who's contributed her expertise and her feminist techne, basically, in live streaming talks, and who has organized the most dynamic speaker series on feminism, technology, and digital culture at McGill for the past 4 years now, I think is how long that's been. So thank you, Alex. I'll say one more thing about that. Those speaker series have really, I think, transformed the intellectual and political conversation on campus. So Alex, thank you so much for that. I also want to thank the Institute for Gender, Sexuality, and Feminist Studies for their really generous support, and Director Natalie Stoljar, Andrew Folko, and CU Lee for their work organizing today's student seminar with Kath. I also want to give a warm thanks to Professor Stephanie Duguay, who runs the Digital Intimacy, Gender, and Sexuality Lab at Concordia. Professor Duguay co-organized Kath's visit here in Montreal with me and has provided a number of forms of generous support for this talk and more. I also want to thank Chris Dietzel, who's a postdoc in the Diggs Lab with Stephanie, who's also been super helpful. And finally, I want to thank our anonymous donor in the Department of Art History and Communication Studies, who helps fund our speakers series. And that is fantastic. So thanks, everyone. Oh, I need to breathe. So let me introduce you to Kath. Professor Albury works in the Department of Media and Communication in the School of Social Sciences, Media, Film, and Education at Swinburne University. She's the Australia Research Council Future Fellow and leads the Digital and Data Literacies for Sexual Health Policy and Practice Research Project, which is a 4-year project that runs from 2022 to 2026. She's also chief investigator on the Swedish-Australian collaboration project, Digital Sexual Health, Designing for Safety, Pleasure, and Well-Being in LGBTQ+ communities, that also runs from 2022 to 2025, with Professor Jenny Sundin at Södertörn University in Sweden and Dr. Zara Stardust at Queensland University of Technology in Australia. In 2021 to 2022, Kath led the evaluation and research for the Crushed But Okay project, which was aimed at de-linking feelings of rejection from the desire to harm or punish those whom one has been rejected by. And Kath has done a lot of research that does similar kinds of work, and we might hear some about that today, I believe. She is also an associate investigator in the Australian Research Council Centre of Excellence for Automated Decision-Making and Society program, where her research focuses on the development of data capability and capacity in not-for-profit organizations and data ethics and speculative design justice in the field of sex tech. Her past projects have investigated how young folks digitally self-represent and the role of user-generated media like social networking platforms and dating apps in young people's sexual learning, their safety, and their well-being practices. I'm almost done. She's the author and or co-author of the books Yes Means Yes, Getting Explicit About Heterosex, which came out in 2002, Young People and Sexting in Australia, Ethics, Representation, and the Law from 2013, co-author of the polity book, Everyday Data Cultures, which is a bottom-up, approach to the everyday datafication of culture and people's experiences of that. Also co-author of the Palgrave Pivot book, those little slim volumes, which are so fabulous, called Data for Social Good, not-profit sector data projects that provides community organizations with ideas and best practices for how to work with data and utilize data analytics towards social justice. And that book is open access for anyone who is interested. Kat also, if you will allow me, Kath, cut her teeth doing activist sexual health work in communities in the 1990s around the HIV and AIDS epidemics. Just a small word on protocol. That's my introduction here. We'll see the title is Digital Sexual Health from Literacies to Capabilities. Since we're hybrid, there might be questions both in room here and online. We will keep an eye on the chat and put that up on the screen here and just sort of move in between what's happening in space here and for you folks online as well. So thanks for being with us, Kath. Come on up and tell us what you would like to talk about today.
Yeah, sure, it's blurry.
And can I make one note?
Yeah.
And for folks on Zoom, if you have questions, you can write them in the Q&A box and we'll attend to them during the Q&A session. So it's a special box for questions.
Thank you. Apologies, I got the date wrong. So it's the date from my last talk, not my current talk. I'm mortified. And also for people on Zoom who don't already know, I have this throat thing. It doesn't hurt, but I'm croaky. So apologies, and I hope it's still clear. I would also like to acknowledge and pay my respects to the traditional owners of the lands we're meeting on today. And also pay my respects to the traditional owners of the lands where I live and work, the Wurundjeri people of the Kulin Nation. So this project, let me now work out how to get forward because things are, there we go. The project I'm talking about today is the ARC Future Fellowship, and thank you very much for the kind introduction. Yes, Carrie, it does have a bit of a history, and I'll talk about the history of this work and how I got here. The Future Fellowship is a 4-year project. The work I'm presenting today is not a solo effort. It's very much co-authored with Dr. Sam Mannix, who's postdoc on the project, and Caitlin Lermuth is our PhD candidate as part of the project. But yeah, in addition to my past work in sexual health or health adjacent work, which you'll hear about in a minute, it's also the work I'm talking about today is very much influenced by my collaborations with my colleagues in the ARC Centre of Excellence for Automated Decision-Making and Society, which is a cross-institutional research network, and very much influenced by my work with my Swinburne colleague, Professor Anthony McCosker, who leads the node there and led our Data Capabilities project. So you'll notice here on the slide, it says the ARC Future Fellowship project is called Digital and Data Literacies for Sexual Health Policy and Practice. I have switched the title of the project now from literacies to capabilities. And this paper really is talking about why we made that switch and the politics, but also the pragmatics of changing that terminology, and why I think the different terminology fits what we're trying to do a little better. So to begin with the pragmatics, in the Australian policy context, capabilities is an important term right now, and we're in a particular moment, or, you know, my cultural studies colleagues might say a conjuncture, where capabilities is very central to workforce development. And there's a lot of high-level strategic work across kind of the workforce sector, but particularly in the field of health, that aims to build capabilities going forward for the health workforce, particularly around digital and data capability. And, you know, this is something that was in train for a while. So questions of how to streamline electronic health records and point of care technologies and data practices, but has been kind of intensified and hyped up, I guess, and made quite pointed and a bit of a sore point, I think, because of the impacts of the COVID lockdowns. I was in Melbourne in Australia, which had one of the longest lockdowns in the world, so became, you know, the city of Zoom very early on, and stayed the city of Zoom for a long time. But many health organizations in Australia were very risk averse for a long time, particularly in relation to sexual health. Obviously, sexual health is a stigmatized space. A lot of sensitivity around conversations around sexuality and health, and a lot to lose if those conversations and that data is not handled sensitively. But we know at the same time there's so much vernacular use of digital platforms for sexual health now, you know, ranging from you know, WhatsApp chats about where to find the most kind of kink inclusive practitioner in a particular environment, or a more formal interaction with a clinic's interface, or even, you know, the ways you might craft your profile on a sexual health site, where some sites more for men who are seeking men than other people, but you might actually have the capacity in the drop-down menu on your profile construction to negotiate sexual health directly and negotiate particular practices in relation to HIV treatments or prophylactics or HIV status or those kinds of things. So these kind of, we call these things kind of vernacular sexual health practices. And my interest in this work comes from what I've seen over a number of years as a kind of disconnect between everyday practices of sexual health and sexual well-being and sexual learning that use these kind of vernacular platforms, and the ways that institutions, for want of a better word, imagine digital technologies and digital practices in the everyday. So I guess this whole project was a result of being invited many times over many years to speak to some of my past projects, which Carrie very kindly spoke about in the introduction, where I had been doing research around young people's digital practices of self-representation. So, you know, ranging from amateur porn practices to selfies to sexting, to then kind of online sexual negotiation and sexual learning. And I was very often invited then, and these are some of the publications, you know, that I've been invited to speak to talk directly to people who are youth workers or high school sex ed teachers or sexual health practitioners about, you know, what do young people need to know? And the answer often presented to me, you know, from the people that I was talking about, it's like, well, we think they need more media literacy. And as a person who had been teaching and researching in the field of media and communication for a long time, I'm in my 50s. So, you know, I came of age, I guess, in a pre-digital era myself, I used to hear again and again, like, we've got no idea what they're doing. You know, we're old and they're young, and there's no possible way we can understand what they're doing. But we do know they need more media literacy. And my question was, oh, media literacy, what do you think that is? And I was very curious. And it often seemed to me that media literacy was being proposed or being talked about in a very different way than I might think about literacy in other contexts. And you know, I mean, in English class, if you're being taught literacy, it's presumed that you will not just read, but you will also write, and that developing strength and capacity and skills to create is part of literacy. But when people talked about porn literacy, for example, it was like a kind of aversion therapy in some cases, or like a kind of learning what not to do. And to me, that sounded like abstinence education, not literacy education. And we know from evaluations of abstinence education that it's not hugely effective for what people think it should do. And it has some really weird, unanticipated effects and can cause harms in many cases. So I developed this curiosity. I had a little pot of funding. I had a great colleague, Dr. Paul Byron, who could work with me on this project. We had worked together on the young people and sexting project. We had then moved into beginning to work with dating apps and thinking about people's perceptions of safety in dating app cultures. And I began to be curious, like, one, I kind of had the feeling that I never wanted to go bother young people in high school ever again, because I was really tired of hearing that what we just need is to hear young people's voices. It's like they have been saying things to you for a long time. What you need to do is maybe listen. So I didn't want to go interview young people until I felt like I knew what actually would create a fertile environment for enacting change. And to do that, I felt like I really needed to talk to educators. I had been part of a project where I did kind of some pilot interviews with educators about what they thought media was and how they understood their own media literacy and the media literacy of their peers, their adult peers. In this project, I thought, well, okay, there's a sense in which I'm not sure how people understand media literacy, and maybe the best way to really elicit some different sense of what that is for adult workforce members is to do the kind of media literacy workshop that we might do with young people, but do it with adult participants. And so in running this project, obviously these were the research questions. How do educators understand young people's digital cultures? How do they rate their media literacy? These are kind of formal research questions, but how we pitched this as a research exercise or data elicitation exercise was, would you like to do a media literacy workshop addressing media literacies in relation to sex education? And we ran workshops in collaboration with a range of organizations, including family planning organizations in Victoria, New South Wales and Queensland in Australia, so 3 states in Australia, and also the Alana and Madeline Foundation, which is a youth violence prevention organization that had done some anti-sexting work. And we ran both kind of what I would consider to be like introduction to media studies, mini lectures. So I talked about Stuart Hall and coding, decoding, and those kinds of things, the kinds of theories that allowed me as the older person to think about digital culture without actually having grown up with mobile media or platforms, the kinds of transferable theories that I used as a kind of toolkit. And then we did some hands-on exercises taken from the Selfie syllabus. And the Selfie research group was a huge network from the Association of Internet Researchers. It was a pre-conference activity before the 2014 conference, I should say. I hope this work is still online. If it's not, I can find references for people who would like it. but we developed a syllabus for teaching in high school and college classrooms using what I would consider, literacy practices, what kind of embodied literacies, where we took selfies and talked about the practices of taking selfies and used that as a way of thinking through media practices of embodiment and the kind of affective dimensions of that. So, it was really interesting when working with adults. One of the people would say to, one of the teachers said to me, she said, I asked them to take a photo. This was one of the exercises. Take a photo that you would use as your profile picture for a dating app where you were seeking marriage. And of course, there's much hilarity with different groups. And I was like, whatever marriage means to you, could be a throuple, could be a polycule, doesn't matter. And one of the teachers said, well, I used to really judge young people for taking all those pictures, so many pictures. And she said, but then when I had to take a selfie, the first 15 were terrible. I'm like, I had to keep going till I got a good one. And there were people who would refuse. And then we would talk about refusal and what was at stake in refusal. Really, there was no wrong way to do it. It was a means of eliciting a conversation about gender and sexuality and bodies and digital media. And so this was a really rich and productive project for me, and kind of sowed the seeds for a lot of the work I've done since, the dating apps project that I've done and a few other things too. Because what we really found was obviously digital media practices are not exclusive to young people, but for adult professionals, be they clinicians, be they educators, we had a lot of policymakers, people from youth justice. They had to that point been primarily framed as a site of risk. And that framing or the fear of those spaces, or the concern about them being dangerous places for young people to be, was really intensified when adults were unfamiliar with platforms and the specific technologies, or when they had a very classic, apologies, mass communication people, but when they had a very classic mass communication or psych model of impacts and effects driven understandings of media, as opposed to a kind of culturally informed, social spaces discussion of media, or idea of what media was and what it did. Methodologically, what I learned was that participatory and practice-based activities are a fantastic tool for engaging with professionals and expert stakeholders in research, and that they were a really good way to build networks with community partners, particularly when they included a kind of, I will share what I know about the research to date, and now let's make and do and see how you think about the practice when I've talked you through a little bit of theory. And that seemed like a very productive conversation starter and research practice. And finally, in terms of all kinds of research elicitation, it really confirmed for me that making and doing with social media is so much richer than sitting and talking about the issues, particularly when people feel like they have to give you a correct answer or a soapbox kind of version of their take of media participation, that actually making things, or even drawing pictures to do with your media history. So we did in the dating apps project, we asked people to draw a timeline of their experiences on different apps, and just doing that as a reflective exercise and doing a show and tell was a really productive exercise. So I learned a lot from this early project that I've taken through to the work I'm doing today. So that's just like the little origin story that I wanted to give you to make sense of why this capabilities project is happening now. So I was very, very fortunate to get funding from the Australian Research Council for a 4-year project where we promised to develop digital and data literacy resources for sexual health professionals. And it was built on the findings from these earlier workshops, that it was a space, it was definitely a space of anxiety for a lot of people in the field. It was a space they increasingly knew they needed to engage with, particularly in sexual health in relation to dating apps or social platforms, and the intersection of sexual health and mental health, and kind of broader social well-being and connection. So, so much revolving around digital platforms and other resources. This became a key space where people needed to work, but there was a lot of trepidation and anxiety about these spaces. So to begin our project, we thought, let's just kind of develop a baseline. How are digital literacies already discussed in the field of sexual health? To make sure we're not reinventing any wheels. And in addition to the literature review, which was led by Sam Mannix, we conducted 29 interviews with people we identified, either because we already knew them or because we lurked on their websites and checked out their keywords, who had something to do with sexual health and digital technologies and digital literacies. You'll see the number of researchers doesn't quite add up to 29 because people in these spaces wear a lot of different hats. And so we interviewed 29 people, but some of them had worked across public health, women's health, sexual health. They ran a clinical space still. They also managed a research program, et cetera, et cetera. So these were people with really rich expertise, both theoretical and experimental, but also like practical day-to-day in sexual health clinics. What we discovered was that, yes, digital literacy and digital health literacy were talked about a lot in this space, but it wasn't always clear what they meant. So in terms of the literature, and we are publishing this article, hopefully this year, it's in review right now, so I'm not going to go into a deep dive into the literature review, one, because it doesn't make a very sexy seminar, and also because it's like, I want to do the teaser for the publication. But digital technologies are primarily viewed as kind of instruments for delivery of health information or delivery of clinical health services, but it's like they're conduits. The terms digital health literacy and digital literacy were used very interchangeably in the literature. It didn't seem to be clearly talking about one thing or another. Where digital literacy or digital health literacy was discussed, it was a relevant skill or an attribute for individual consumers or patients. It was something that they needed. It wasn't about us so much. There were some publications that talked about how digital health workforces needed to be prepared at undergrad level for digital literacy, but those kinds of articles talked about things like nurses needing to understand the full suite of Microsoft Office, or those kinds of things. It was very much about using a particular tool. And it's interesting, when you think about the ways media or tech is taught in high school, often there's a kind of divide between the media and technology courses that are about, we'll code a robot, we'll make a short film, we'll do a thing. And then the English department or the phys ed department that teaches critical literacy, where by no means should you make something, because what we're talking about here is sexy selfies, and we really don't want you to make any of those. We want you to know why they're against the law and bad. So it was, there was a similar kind of divide in this literature. And I'm kind of joking around about this. It's not that I think that, yeah, everyone should go out and make sexy selfies and there's no risk or concern associated with that, but it's just interesting to see the very big divide in the literacy discussion, which doesn't always dig down into some of the historical debates about the term literacy, which I will get to at the end of the paper. So digital literacy was an enabler of particular kinds of sexual health outcomes, its behavior change, its treatment adherence, access to information, but it's a tool that does a thing like that. It was very much seen as an instrument. Data literacy wasn't really discussed in this literature, although there are some emergent conversations around, in Australia, particularly because we're building new connected medical health records. There are some articles discussing, for example, HIV positive people's concerns about having their health data linked. And there has been to date a lot of opting out of those linked systems by people who rightly are concerned that they will experience stigma if their data is linked in that way. In terms of the expert interviews, it was really interesting because when we talked about data was a floating signifier, I'll say, going back like again to cultural studies, kind of literary based understandings of media. It meant a lot of different things. So it's like, oh yes, we work with data. We're very up to date on the epidemiological research. Data was generally a thing that came in from outside. So it was research data, but it had been already processed and kind of synthesized, and meaning had been made from it because it was like the output of research. It was research findings. That's the data. And it's like the evidence base, I guess. Some places understood themselves as a health organization to generate data. And that would be maybe around like, the clinical data that they were keeping or that they might be sending to a study or to government funding bodies or kind of compliance data, and they understood there were privacy rules, they needed to protect the health data, and that's very clear. Some organizations, though, it was interesting, didn't understand or didn't, the people that we spoke to said they had some concerns that their organization maybe didn't understand that things like websites and newsletters and social media accounts generated data, and that it's those everyday platforms, the organization was generating data about health consumers based on what kind of information they sought. And so one person, and this was talking about an enterprise platform, said, we have a database that I can use, to push particular kinds of email information to our consumers. And it's the same as any client database that any organization would use for marketing. She said, but I have the capacity to know who in our database has been searching for abortion information on our website and potentially push notify them. It's like, we do not want to do that. That is dangerous for our clients, for us to say, so you want to know more about abortion, like that is dangerous for many clients. There's all kinds of other clients, if they're asking about, gender diversity or transition, or maybe I have an STI or whatever, you don't know who else has access to their phone, all those things. She said, I know that I shouldn't use our software for this. I don't know that the person who bought the software knows that we can do this. I don't know that the people at the head of my organization have a policy around this, and we probably should. So in thinking about policies, it was like the first thing a lot of these organizations probably needed to do, we thought, based on these interviews, was have a really long talk about what data is in their organization and the different ways of thinking about data. And clearly there was siloed expertise. There were in health, it's really important to be a specialist, and particularly, it's life or death for many people in the health system, and you want someone who's got extraordinary depth of expertise. But what that often makes or manifests in health organizations, from what we were told, is a kind of blinkered approach where it's like, I specialize in this thing, I don't touch that thing that you're doing, but where everyone's using the same kind of digital resources and platforms, or it's very important for different people across the organization. Some of that siloing can be a problem. That there needed to be both collective knowledge, but also individual building of skills and knowledge. There was also some really significant concerns about the ways that data was handled and the ways that the community members or the populations who really had an interest in the data in a particular clinic were or were not included in decision making and did or did not have access to their data. And this particularly related to the Aboriginal controlled community health services, where one of the people we interviewed said, look, I'm a bit concerned that people in such and such organization have had to join a clinical trial that they might not otherwise have joined because they don't have good enough infrastructure, like they don't have the machines and the software to process the data the way they need to process it for their community. But what that means is they have to send it away to the big study at the university in order to get it back. It's like, we actually, like, in terms of data sovereignty, we should have direct access to our data. We shouldn't have to go through the university and get it back. And so there was a need to really attend to what communities should be able to do and how they should be able to own their own data. And everyone also said, you know, and it's a funny thing coming back to what I said originally, you know, digital is young people and we need to work with young people to understand how it works, even though, of course, they were all on the platforms and the apps and stuff themselves. And our project does have a youth co-design component, fortunately. But yeah, so we thought about these discussions about literacy, and I had already been involved, as I said, in the data capabilities for not-for-profits projects led by Anthony McCosker and Jane Farmer, my colleagues at Swinburne. And I began to think about digital health literacy. It's funny, I keep missing a picture and then it comes back. Sorry for the toggling. Like there are histories of thinking about literacy that think about some of the issues that were being raised in these conversations about you know, what literacy is for and who has access to particular kinds of knowledge and what kinds of knowledge even count as literacy. So the field of health studies, actually, you know, health literacy is very contested within health studies, public health. We read a lot about the ways that health literacy has been poked in this same way within the field of public health. People saying, you know, we talk too much about health literacy as being something that clients or consumers need to have, but we want them to have it so that they, in a sense, are more compliant. It's not, you know, it's not about them having more agency or always a better capacity to navigate our services and to advocate for what they want and need. In a collective sense, we are talking about it too often as something an individual lacks and needs, and that we need to, and something that again is very, something that should be very easy to assess with a quantitative measure. Like we should be able to get someone to fill in a survey and a checklist, and we should be able to assess their health literacy, and then we should be able to give them the information that suits that level of literacy, and that should be an easy and kind of operational process for us. And this, you know, there's good reasons why it's been talked about in this way, and the move towards promoting health literacy, I'm not saying comes from a bad place, it totally comes from a good place, but I'm saying the concerns that we had around the digital literacy conversation really aligned with some of the concerns we saw in the literature about health literacy. And this resonates with the history of literacy across fields of language and linguistics and culture and communication. Literacy has been really pushed around as a concept since the 1950s. The book cover in the middle, Richard Hoggart's Uses of Literacy, which is one of the kind of highly influential early studies of the ways that literature and kind of the cultural capital that comes with literacy was used to entrench class hierarchies in 20th century England. And then more recently, the field of critical literacy and critical pedagogy, Freire and colleagues, particularly has been applied to the space of media literacy and beyond that, digital literacy. And some of that work that I was talking about with the, taking selfies and talking about it is really comes from that history of the pedagogy of the oppressed and the kind of bottom-up literacies or vernacular literacies and the recognition of everyday forms of expertise and the ways that we can think about that in kind of politically mobilizing ways. So digital health literacy in this context would be not just the capacity to read, seek out and understand information relevant to one's health, which is the way it's often kind of defined. In digital literacy, it's like, now it would be about decoding misinformation and disinformation, but it was, in previous times it was defined slightly differently. If we think about it in relation to kind of these contestations that are often called like new literacies, if you're thinking about health literacy, for example, you're thinking about being able to engage actively in a collective culture of advocacy and critical debate and activism that would support communal health or communal safety or communal well-being. Obviously, the individual is part of the community, but it's less atomized than that. It's harder to measure by an individual filling out a checklist in the lab, for example. And Annette V's book, Coding Literacy, is a really interesting text in this space because V is a literacy scholar, a literature scholar who looks at that moment in the US where everyone was kind of pushed to learn to code. And she says literacy has never purely been understood as an instrumental means of transmitting or receiving information. It's never been, we've never seen the social and political benefits of literacy as the outcome of functional proficiency, like just being able to do the skills on the checklist. But she says it's always been this kind of exercise of capital. It's associated with the ability to understand and use the intellectual resources provided by some 3,000 years of diverse literate traditions. And like literacy is about understanding the canon, whether that's said explicitly or implicitly. And V is really useful to think with for our project because she really thinks about workplace literacy and teases this out. And she says, we don't, only some kinds of jobs are said to require literacy, even though you read and write for every job. She said, you don't call the mechanic car literate. You don't say my barber is really hair literate. Trades are not often associated with literacy. The skills of a trade are not considered a literacy. And this really, kind of brings home that this is about power. I mean, that's in the bluntest kind of old school way of saying it. Literacy is about power. So there's a social value attributed to literacy, and there's a stigma assigned to those who are illiterate. As V says, unsurprisingly then, as we found in relation to health literacy, as we found into digital literacy, there is little contemporary or historical consensus on what literacy is or what kinds of skills one needs to be literate, because it's a morally good but undefined concept that can serve as a cipher for the kind of knowledge society values. And it has to change over time. That's why digital literacy is hard to fix in our literature review. And it made a lot of sense to us. And the discussions of health literature said very similar things. So in moving, from literacy to capabilities, we really wanted to think about initially when I started the project, I really wanted to think about like building and skilling up people in workplaces to build literacies, but we had really seen in our data project and in those other projects that I talked about before with, rethinking media literacies, for many adults, there was a lot of shame associated with even one to be in relation to new digital technologies. And you all know that kind of anxiety that comes in when you're forced from above to move to a new software platform in an organization. It's like on X date, we're all going to change over. And if you can't use it, like we're all going to eye roll. And, the person who's slow or the last person to get it is going to have a really hard time. V, I think is I really like what she says about this, which is really generous and much more generous than I think a lot of people are in workplace contexts to those who are perceived to be illiterate. When you have very senior, very skilled practitioners, particularly in health, where it's often been a very face-to-face, empathetic space, and people push back pretty hard at digital as being impersonal. It's not that these individuals have lost their literacy, but that literacy has moved on without them, and they feel that their existing literacies are no longer valued. So for this reason, among many others, among the pragmatics of well, the government says it's capability now, so we'll say capability. We moved from literacies to capabilities in my project. I'm just going to do a little toggle. And this is something, again, that Anthony McCosker had kind of led us on in our previous project, and I resisted it really hard in my project, but I finally gave in because it made so much sense. And this is what we say in the article that we wrote here, and I don't know why I put 2017 there, sorry, it should be 2022. The references are at the end in the final slide anyway. We liked the term data capability when we were doing these workshops with not-for-profits because our projects were bringing together social scientists and data scientists to work with people with all kinds of roles. It was people in the IT department or someone from the board who ran the not-for-profit or whatever. And we were trying to find a term that everyone on our team at least was happy with. And the social scientists and the data scientists couldn't agree on some of the terms. Competencies wasn't quite right and all those kinds of things. But capability we could all agree on. And the data scientist was really happy with the term capability, because in data science, capability has a double meaning relating to personal attributes and technical components, software, hardware, a combination of the tangible and intangible elements that underpin the creation and use of data. And we really liked this double meaning because it moved the conversation about literacy along from like, oh, this individual, she can't open a PDF, boomers, they're terrible, like what? And it made it much more about what is the organizational infrastructure in this place? Where are the policies that enable? For example, when I was first doing that work with health promoters in Australia, and this is a long time ago, like 2014, 2015, I was saying, oh, do you have a Facebook presence? Back when Facebook was still a thing for young people. And they'd go, we would love to be on Facebook, but our organization has a firewall, and Facebook is seen to be a time-wasting, non-productive platform, and no one can log into Facebook on a work computer. I would have to get like the Department of Health would have to let the firewall down, which it's never going to do. So no, this youth sexual health service doesn't have a social media presence for that reason. And I would say that's not an issue of individual literacy. That's an issue of organizational capability. And that's why I like the term capability, because it responsibilizes people at different levels of the organization. So this is all nice. What did we come up with in the end? We have adapted the model of data capabilities for the not-for-profit workforce. There's a report associated with this project, a preliminary report that spells all this out in a lot more detail, which is, I'm just giving you the one pager. And obviously we'll be going into academic research for the next stage of this work. But based on the participatory workshops that Anthony McCosker led with the not-for-profits that I was part of over 2020, 2021, came up with with 3 areas of capability. The first is access and infrastructure. The second is skills. And so that's, the individual level a little more. The third is governance. And that's where you might think about data stewardship. The model that we developed through the Center of Excellence for Automated Decision-Making in Society just refers to data. In this model, we look at data and digital capabilities separately. And I actually was on a call with some people in health research the other day, and they asked why we separated them out. And I thought it was important because of those things I was saying at the beginning of the paper about what you might term vernacular platforms and technologies. So I really wanted people in the health workforce to think about sexual health technologies as something beyond the platform that they use to collect a sexual history, or the diary that, the MedTech developed diary that they use to ask people to track symptoms, and report back. And to ask themselves, within their organization, when they're developing strategy, and you can see we have some core questions that we would invite people to ask. Let's throw away our preconceptions around what a sexual health technology is, and ask just from baseline, what counts as a digital sexual health platform or technology? And not just what counts to us, but what counts to our consumers. Because if you're negotiating a hookup on Grindr and you're doing that by looking at each other's statuses and looking at whether you have an undetectable viral load or not, and whether you're on PrEP or not, Grindr is a sexual health technology, I would say. But that's not always the way that people in a clinical space would think about this stuff. So we have some more questions, obviously, for discussion in an organization, but this just gives people a kind of starting point. We developed these guidelines, or this kind of prototype framework. We took it to our expert advisory board for checking and feedback. They're pretty happy with it so far. Next steps, we're going to take it to a group of sexual health consumers aged 18 to 29, so young people, which, like a lot of policy documents, the Australian sexual health strategy defines incredibly broadly as everyone from 12 to 29. There are priorities sexual health population in Australia. We are only talking to 18 to 29-year-olds because I want to be able to talk about activities and platforms that are not legal for under 18-year-olds. We will be recruiting peer co-facilitators to help us translate that kind of high-level capability model, to workshop what those mean for health consumers, and then to build back resources for sexual health workforces. So then we can take these back as kind of training modules or whatever. So it's like, okay, what does the research say? What do we as people who are working in digital literacies and data capabilities say digital and data capability is? Okay, now what do your consumers, clients want you to know about their vernacular digital and data practices, and also about the kinds of platforms and technologies you are asking them to interact with in your organization? So how do we, it's incorporating the consumer practices into the expert practices, if you like. And of course, many of the people who are working in sexual health are themselves like hooking up on apps or having WhatsApp chats or whatever, but they might not necessarily think of that as practicing sexual health through digital platforms. They might not. So that'll be an interesting conversation too, whether people think about their vernacular practices in the same way they think about, what you might term the industrial practices of digital health and data health. So that's the end of the formal presentation. Thank you so much for hosting me. Thank you so much, Concordia and McGill and all the wonderful people in this room and the people not in this room, including your anonymous donor, for hosting me here today. And thank you to all of our research collaborators, including the interviewees who are not listed here. There is some further reading. I'm really happy to share that almost none of the things I list here are paywalled, but if any of it is, or if there's anything else that is paywalled, I'm happy to share. And I will stop screen sharing now. And I'm really happy to take questions. Thanks so much. If there are questions in the room, what I'm going to do is repeat them back for the Zoom people.
Adam, do you want to ask a question? Yeah, this is a very loose question.
Yes.
Yeah, so there's many sides to this. I guess one side is like the realm of platform design and how platforms are gathering data and at which scales they're operating and such. I was wondering if you looked into that aspect.
So the question, there are many aspects to thinking about data in relation to sexual health, and one of them is how platforms, I'm assuming you mean platforms like Grindr or Facebook or whatever, collect data. Yes, that is something we're thinking about in this project, and we have looked at in past projects. Obviously, that kind of data collection is kind of seductive to public health. Like the World Health Organization a few years ago put out a report on, we don't know enough about what men who have sex with men are doing in the Asia Pacific. It would be great if we could like scrape the platforms. And we, when we first read that and other times since, have said we don't think that's really very ethical. And in fact, what we know is when that stuff starts happening, often the police are getting in at the back end into people's data too, and in places where certain kinds of sexual contact or illegal, police are using platforms to entrap already, to set up dates under false pretenses and then arrest the person who turns up for the date. But if the platform is just handing data over, like that's a real problem. We know they do, platforms do collaborate with sexual health organizations, but and often like promote advertising or provide sexual health information and different kinds of chat. But yeah, the kinds of data that we give to a digital platform obviously is kind of necessary, because to establish intimacy, we need to be vulnerable and to share of ourselves, but also, there are people in this room who do this work as well. It creates vulnerabilities, and it also, is monetized and aggregated and used for various commercial purposes that we might not always consent to if we were given a transparent opportunity to consent or opt out. And that is, yes, something we'll talk about in relation to digital capability, is thinking about that. Yeah.
Thank you so much for your talk, Kath. I really appreciate this, because I think digital literacy is sort of amorphous term that gets put on the grant applications as a vague outcome that may or may not be looked upon favorably by reviewers. So I really appreciate that you're challenging this term. I have like two questions, but one's more straightforward and long form. So I'm gonna ask that
Yeah,
one.
yeah.
And then later this time we're chatting, I will give you about the other one. But so the straightforward one is just that you mentioned briefly that the term competencies came up.
Yeah.
Was started. And so I was just wondering what are you seeing as a difference between capabilities and competencies, and why capabilities?
Yeah, so the question is why capabilities and not competencies? We did think about competencies, and there's a range of national policy documents that use the term competencies. The DigiComp document in Europe, which the Australian Digital Capability Framework is based on, does address competencies and talks about digital citizenship, which is less in the Australian capabilities model. So you can see what's picked up and put down in different policy spaces. Competencies for us seem to still too much sit at the realm of the individual. Whereas, yeah, we liked that double meaning in capabilities, you know, that when we're running them by the data scientist in the, brainstorming session, and he went ding when we said capabilities, he's like, no, that makes sense in data science too, because it's about the hardware and the software, not just the person who can do the thing or can't do it. And I think it's important because there are a lot of organizations buying platforms that don't talk to the existing platforms. Like interoperability is a really big issue, and it's an issue that's being talked about in the capabilities project. There's a lot of wasted opportunities to work with data. We found in our non-for-profit thing, there were a lot of organizations where it's like, yeah, we would love for the HR department and this other department, to come together to understand better what is happening for our workforce. It was a disability support organization, and they had carers there was a very high turnover, and they could tell it wasn't just about the salary, it was other things about the working conditions. It's like, we know we're collecting data all over this organization, and we would love to know more about where we can make this job more attractive to our workforce and increase retention. But because this is on this platform over here and that's on that platform over here, and HR brought its own piece of software there, and someone else had a grant, and the IT acquisitions process was 3 months, and so they just went and bought a thing off the rack and it doesn't talk to anything else. Capability speaks to that infrastructure stuff. And the IT people that we spoke to as part of the not-for-profit project liked that as well. Yeah. There was another question. Yeah.
I want you to go. Yeah. All right, so thank you so much. I was very interested into your thoughts about literacy versus capability. I think for me, it also resonates between the difference between our ivory tower in academia versus the hands-on work that we can do when we're activists. And you mentioned also that you have a past in activism. And so I wanted to know more about that, actually, especially because sexual health is such an important topic. It has to be done by activists, actually, to exist as much as possible. So I wanted to know how you articulate yourself, your academic life and your activist life.
Yes, the question is how I articulate my academic life and my activist life. And fortunately for me, that has been pretty comfortable as a match. So I was when I started doing my drag character, Nurse Nancy, I was already doing honors. And she did kind of survey work, but it was like satirical surveys. And it was in the context of, at that time, kind of queer party culture, where there was a lot of social research going on at the parties still. Like that's where they were asking people about sexual behavior and stuff, because it was a good place to recruit. And so, yeah, it's always had a kind of legitimacy. But I mean, what I've found interesting about it is because I've spanned the space of HIV health, but also other spaces. So, violence prevention work, mostly working with cis heterosexual men, or women's health work, or the sexting work, which was with younger people. I have had a really interesting insight into the ways a practice that is commonplace in one site is pushing the boundary in another site often. So it would be unheard of in HIV, sexual health stuff to not involve the community most affected by HIV in a discussion about strategy and approach and creating resources and those kinds of things. But for a very long time in youth health, the health promotion worker just decided what they thought the young person needed, and they made a funky website or a poster, and they took that out and they had the learning outcomes or whatever. And if the young people were involved, they were like in a marketing focus group where it's like, do you like the green or do you like the blue? You know, and that's not really co-design, and it's not really engaging lived experience and expertise. And I have published some stuff about that, but it's like, it's partly because young people do a lot more than they are legally allowed to talk about. But also I think it's adult discomfort. But there's a lot more co-design work going on with young people. And that's where I think I've kind of integrated the activist work into my academic work, one, by throwing up my hands and walking away from interviewing under 18s, because I think that's bad faith. If no one listens to them, you're just bugging them, basically. Or promising something that won't be delivered. I got bitter, you can hear it. But also why I'm doing this work now, because I think this is a space where you can say digital literacy is not just for them, or, you know, digital capability is not just for them, it's for us. It's for everyone. And we're all in this culture together. So let's understand the different ways that it works, and let's build something that works for everyone and doesn't shame anyone, ideally. You know, isn't about deficit and, you know, failing to meet your KPIs or whatever it is for the various stakeholders.
Okay, great. Yes, there's a question on Zoom. One's coming from Erin Lee Rosenberg, PhD, writes, in our universities, the name and content of courses are not as quick to change as the discourses and language we use in those courses. For those of us who might be literacy scholars or teachers of courses about various types of literacy, how do you think we can work within the language of the courses / institution and also embrace the kinds of critiques and new ideas that you brought up today?
Yeah, I think that's hard. I think there's a lot invested in literacy, and a lot of, you know, the concerns right now about disinformation and misinformation. And we've just had a referendum that had a terrible outcome in Australia and was very impacted by misinformation. And I understand that literacy is still at the heart of a lot of the conversations about that. And there are contexts where it's still really important, but I think understanding or being able to acknowledge the contestation within the term, and that it's not new or novel to say, hey, this is contested, like there's a very long history. I mean, that Annette V's book, Coding Literacy, is a beautiful historical account. She said, you know, from the time people learned to write, literacy was already taking on a social meaning, and you know, a power. There was already power built into it, and it's not like this is new or novel, or because it's related to software now, or, you know, or digital platforms. And sometimes I think, you know, one of the things I understand is that teachers or health promoters or people in clinical practice are working under duress. They've got time constraints. They've got constraints based on their institution. They have to demonstrate certain outcomes. And when that happens, when we're short of time and short of resources, we kind of shortcut through the messy stuff and just go, this is the bit I want you to get from this. I'm not going to overcomplicate it. But yeah, sometimes I think some of those practices of making and doing are the spaces where we can complicate. Like, you know, if you say, does having literacy about sexy selfies involve making selfies or not? You know, even should in one of the states in Australia where I'm from, people aren't allowed to have their mobile phone in the classroom. Like, does that promote literacy or not? Like those kinds of conversations, I think, are where in a course that is very locked down and has particular things you need to get from it. Those are spaces where you might intervene or trouble the kind of hierarchies of literacy.
All right, thank you. And then the second question from Antu Hussain, her says, thank you for your presentation. Working in the healthcare setting, the digital anxiety of digital/tech solutions is significant. What are some approaches you have found to reduce this anxiety while valuing the literacy of providers, for example, person-focused care?
Yeah, and that is, and that's the third stage of our project. So stage 1 is this kind of inquiry stage. Stage 2 is the co-design. Stage 3 will be taking back some prototype resources and working with people in the clinical space and actually doing co-design with health carers, again, like the next iteration. Before we say this is done, yeah, we need to make sure that the people who are doing this work on the ground, that these kinds of conversations make sense, that they're reasonable, that they're not seen as you're doing it wrong, that they're not another thing you have to do in your so-called spare time between seeing patients, you know, all of those things. We know people are leaving health workforces in droves post-COVID because they're so burnt out and they've worked so hard, and same with teachers in schools. But given in Australia, at least, that this capability framework is coming and it's going to be compulsory, we're hoping at least being able to offer a set of prompt questions that open up a conversation rather than assessing your knowledge, may be helpful for people working in this space, where at least you can have a conversation that's not about, yeah, do you meet this level of literacy? Do you have to be sent off to the training camp, you know? Because that's what sometimes this stuff can look like, I know.
I have a question if I can ask.
Yes.
I'm just thinking about like how people dig their heels in and are super reticent, especially folks who think they are already different and have all the capabilities, but those other folks don't.
Yeah.
Right, and this like confuses universities. I mean, don't let it's really hard to get people to change their minds and realize they have to learn new things. And you seem to have a very sneaky way of doing it in your research, which is like, I'm gonna come get, tell you about the current research, but then you're gonna do something.
Yeah.
You're gonna make something as part of that process. And I'm just like, again, this might be a kind of strategy question
Yeah.
that we've already gotten, but like, how successful is that? Or do you have advice related to that? I mean, I have a list of things just that.
Yeah. So
Right?
it's
Just like, I just want people to develop of how to like treat people decently who need accommodation. Or
Yeah.
whatever it might be, right? Like just.
yeah. So
basic
it's
stuff.
the strategy question. The question is, how do you engage with people who think they already know everything there is to know and have all the literacies and all the capabilities, and you're just wasting their time when you would like them to open up and think differently? Yeah, it's a hard question. And it's one of the things I found when years and years and years ago, I was doing the work, the violence prevention work with, and looking at pedagogies of the oppressed and various things. A lot of the radical pedagogy stuff assumes you're lifting up people who are disempowered. And it's like, what if you're dealing with people who actually have a lot of power and a lot of privilege, and don't think they need to know anything? How do you start that conversation? And like, I mean, yes, you could send them a link to that knapsack of privilege article and those kinds of, they take that really well. But but yeah, it's an interesting thing. And Carrie, yeah, you said, you know, presenting the seminar is one way to do it. And yeah, that's one way that I've done it. And I think it's easier for me to do it now in my career maybe than it was at other times, because now I use all my markers of privilege. Hello, I'm the professor from the university. I have a prestigious fellowship. I'm a member of an institute. I'm not asking you for money. And they go, what I'm doing is I'm bringing you a resource. And by the way, you know, if you would like to participate in the research, that would be great too. Here's the participant information statement. Let's talk about informed consent. So that's the way I've done it. But I think it works better when you have intellectual capital or social capital. I think it's much harder. It would be much harder for me if I were much earlier in my career, if I weren't a middle-aged, you know, Anglophone white woman. All of those things would be much harder. So yeah, it's tricky.
Online. That you want to ask your other question? I'm just inviting you. You can say no.
I don't know if it got any clearer in my head. But, okay, I think, I do appreciate how the questions have been so practical. I'm gonna break with that and kind of ask a very heady.
Yeah, sure.
Sort of academic question, but when you were talking about sort of defining capabilities, digital capabilities, data capabilities, and it not just being the individual, but also having to do with the environment, the infrastructure and things like this, it made me think of all the sort of attempts to define affordances.
Yeah.
In digital media studies and the sort of expansive theory around affordance, the theories around affordances now that take into account like ecology, design, as well as user imaginaries, developer imaginaries, and things like this. And so, in like, if you go to write about this in academic settings, is there any room to frame capability as sort of what needs to happen to effectively access support from technological?
The question is there any space to frame capability as what needs to happen to effectively access the affordances of various platforms? I'm kind of scared to use the word affordances now because someone will tell me I'm doing it wrong. And so that's why I'm like low theory guy now, because it's like, I'm just going to stay away from the landmines in my field. No one outside of media and communication will police me on affordances, but within media and communication, they will fight me to the death if I use it wrong. So I haven't yet for that reason, because right now I just, for context, like I'm doing a graduate certificate in public health, so I can learn the public health language better. And so going back to fight the battles of media and communication is something I'm not quite ready to do until I've got my head around biostatistics. But yeah, look, I think affordances matter to us. The term doesn't, aside from the kind of classic design sense, you know, Norman Douglas, you know, does the chair afford sitting? Like that's kind of as far as it goes with, and I tried in my addition, you know, initial rethinking media literacy workshops, I tried different theories on for size with groups. I could do a little workshop on, here's the circuit of culture, here's Nick Coldry's, you know, media practice theory. What do you think of that? And we evaluated all this stuff and they're like, best thing you did was the selfie workshop. Thank you. I have the feedback that said, you know, yeah, we would like practical resources. And I think affordances and the you know, I've been reading some of the more recent stuff on the way here. I think it's useful and it's good to talk about and it's good to think about in different ways. But it's something I'll probably get back to later in the project when I'm back to media and comms thinking and less trying to bridge how do I make this stuff more legible and also respectful. Like I don't want to go in and go public health, you're doing it wrong when I don't understand what people are doing. So yeah, it's probably something I'll come back to. Yeah.
I have a question, sorry, more about the hands-on stuff.
Mm.
It's, I find that about activist groups and even community-led projects, and even when academia and community-led projects, sometimes there's a very real issue with archiving stuff.
Mm.
I think sometimes like a lot of stuff gets created, there's a lot of movement around the project, and then all of a sudden, unfortunately, the things disappear. So how have you dealt maybe with archiving the work?
Yeah. Yeah, that's a really good question about how will the work be archived, because so many great projects get created and at some point someone moves on and no one's paying for the web domain and the thing falls down totally. We're very fortunate in this project to have connected early on with ASHM, which is the short acronym name for an organization that I think had a big long name formerly, which was the Australasian Society of Sexual Health Medicine, and that sexual health and HIV, and they do training packages for sexual health workforces, like for you're a GP and you want to know how to operationalize the new guidelines for syphilis testing. Here's a webinar and a pop-up and a practical guideline. And they do a whole lot of working around, like, do people prefer a PDF online or do they want, a piece of cardboard on their desk and that kind of thing. They do really grassroots work with clinicians. They are really keen to partner on this because they saw the capabilities framework in the pipeline, the same as we did. It has a whole arm that is about connecting to education and training, and not just skilling up existing workforce, but rebuilding curriculum in higher education, but also in these kind of professional associations. They run conferences and training that allows doctors and sexual health nurses and people in the workforce to get their kind of continual professional learning re-accreditation. So, you do a webinar and you get X points. I believe they are pretty happy to archive whatever we make because it will go into their modules. And similarly, the National Association of People with HIV also do online learning resources. And we're working pretty closely with them. And they're like the peak body of advocacy for people living with and affected by HIV, not the health care providers. But they do online learning stuff too. So we're hoping not to create a standalone thing that, yes, will vanish into the wind, but to place modules or resources or whatever comes out of the co-design process into existing archives and libraries for training and resourcing, and also then to work with, at some stage, people in our own institutions who are designing curriculum, and to publish into that space so that stuff is citable for them.
But can you the name of the ASHM? It's an Australian organization.
Yeah, if you Google ASHM, it's easier to get than the long name. It's ASHM. Yeah.
Okay. Is there anything I should tell people on Zoom or? No, okay. Thank you so much, Kath.
Thank you. Thank you, people on Zoom.